The pelvic floor muscles. When we're talking about the pelvic floor muscles, of course we have to realise that there's differences between men and women. The fact that there are different passages through the muscles themselves to allow different functions to happen. You can see in the females there's actually 3 different parts going through the pelvic floor muscles which make up the floor of the inner unit. One is around the urethra and the bladder. The other is around the vagina, and the last or the most posterior around the rectum. In the men, you've got 2 different passages that are supported and controlled by pelvic floor muscles. Again, the urinary tract and the bladder, as well as the rectum at the end. So when I speak to my clients about the pelvic floor muscles, so many of them do not understand exactly where they're sitting. And that's why I like these pictures, because they just show how they form like a sling at the bottom of the inner unit or the bottom of the core. You can see the front ones attach onto the pubic symphysis bone right at the front there. The fascia from the pelvic floor actually goes up and over the pubic symphysis and into transversus abdominis. So the 2 of them work very, very closely together. You can see also that the back part of the pelvic floor muscles are attaching onto the coccyx. So they go right across the underneath part of the body, making up the floor of that inner unit. Now, what people do when they're activating the pelvic floor, you've got to make sure that they're not just using the very posterior part of their pelvic floor to pull up. People find it easier to activate and hold wind in and activate the muscles around the rectum than they do to pull up and lift up, like as if to stop a wee from flowing around the front part of the pelvic floor. Now, what the research has shown is that the front part, the pubococcygeus muscle at the very anterior part of the pelvic floor, is actually the part that's got more fascial connections with transversus and helps to facilitate the transversus abdominis in its contraction better. So when you're teaching your clients to activate the pelvic floor, I always use the key words of right at the very front, like you're stopping a wee from flowing, or lifting up and into the body, or tightening around through the vagina if it's a female. If it's a male, I would say to them, feel like you're stopping a wee from flowing, like you're pulling up to stop the flow of urine, or lifting up your testicles. You can say things like, imagine you're walking into cold water and you have to lift your testicles up from the cold water. So it's that feeling of the front part working, it's that feeling of a gentle lift into your body rather than a pushing down or a tension down out of your body. With the pelvic floor, if you want your inner unit functioning really well, you want a very gentle contraction of the pelvic floor. Focus on the anterior or the very front part of the pelvic floor pulling up to help out with that core muscle activation. And you want to be able to pull into your body, definitely not a push down. So some of the top tips that we've put together are things which help to make the quality of contraction of the pelvic floor improved. And these can be things like, if you say to your client as well, don't clench your butt and tuck your bottom under. When people activate their pelvic floor, they flatten their back down on the floor, tuck under their butt and squeeze their gluteal muscles, which is exactly what you don't want to have happening. It is the outer muscles and not the inside muscles, those deep pelvic floor muscles. Furthermore, people usually squeeze their inside thighs and adductor muscles together. Again, this is not the pure pelvic floor. Your pelvic floor muscles do not move your hips into abduction. They are there underneath your pelvis to hold all the contents in and perform all those functions that are required. Do not push downwards. So if you're gripping on tightly with your abdominals and you aren't using that lateral basal breathing, you're holding your breath and you're pulling your tummy in too tight and gripping too tight, that's just going to push your pelvic floor down and lengthen it and weaken it. It's not going to improve the contraction and facilitate transversus at all. Sometimes you will feel when you're doing your pelvic floor lifting, you may feel your lower tummy drawing inwards slightly. So you should feel like a lift and squeeze sensation from the pelvic floors, and then the lower part of your abdominals will draw in. And this is just the transversus abdominis working alongside the pelvic floor muscles together. Again, gently is definitely the word. Don't try too hard, just go very gently. And the other good top tip is think of a quiet wee. So we had a lovely instructor once tell us that you want to imagine that there's Queen is in the toilet next to you when you're going to the toilet. You don't want to push your wee out. You want to think of that quiet wee, lovely and controlled, so that you're very polite with the Queen sitting next to you.